the topic for today, that is AOX. Dr. Chaudhary's hand is risen. In case he wants to say something, you can please talk. So coming to the background, as you know that more than 8 billion babies have been born in the world by IVF, and the live birth rate is somewhere between 19 and 22%. There's some figure I'm giving you. Kuch ratta nahi marna hai iska. Don't take it as a big knowledge, but number is around 22%. I don't know what happens. We carry out 100 IVF cycles and only 22% of them are going to have a live birth rate. We may have a beta-HCG rate of 60%, then clinical pregnancy rate of 24-40%, but finally live birth rate comes to around 19 to 20%. So that's more important. You know, getting a beta-HCG positive actually has no meaning. It gives us happiness and that's it. So we have to see how we can focus on increasing our live birth rate. This is the point of bone of contention. So this is what me and Akriti, we spoke and we picked up this topic for you. We thought this is one topic which you all have doubts, and many times even we have doubts whether we are right or wrong, because we all are using antioxidants. So we picked up this topic for you. And when we have a low success rate, it's a psychological stress for the couple. It's a financial as well as psychological stress. We don't know what to do because we have done a cycle. You spent on average, as I tell you in the class, an average price is 2 lakhs per cycle. This we have spoken many times. Whatever we do by spending money on investigations, by carrying out simple tests like HSG and multiple things, drugs, hormones, multiple visits. By the time a couple undergoes a pickup and pre-pickup, pickup, and then FET after around say 2-3 months, she has spent around 2 lakhs with us. And then the result is negative. You know how it is devastating. This is what we always want to find out. How do we increase the success rate? And for that, when we have something to offer to the patient, we start offering them. And these things are called clinical adjuvants or add-ons. Now, add-ons, how they work, why they work, we really don't know. We have some ideas, so let's see how they work as far as what information I could gather from the internet. But we have to know one thing, that they are expensive. They are in the nascent stage of development. They lack clear clinical evidence of safety, ineffectiveness, and most importantly, they may not be working. That's the data I get from the Cochrane till yet, barring few drugs. But we all are using them, hoping that they may be doing something for our patients. So what are these add-ons, adjuvants? They are basically, they can be the drugs or some procedure or a thought which we can implement along with IUI, IVF or 𝐂𝐤, hoping for improving fertility outcome. So આજકાલ everyone is talking about AOX. You know, the more people make carnitines and DHEAs than people make antibiotics nowadays. Why? Why are people talking about them? So in the market, we are feeling that in case we get these antioxidants together, they're called antioxidants because they can prevent oxidation. So we get them together in some form, they will improve our outcome. We have something more to offer to the patient, and we feel happy that we have done something. But remember, they all are lacking many trials, and they may be harmful in certain cases. Overdoses can be bad, and we have to also remember that we shouldn't introduce them in our practice without clear effectiveness and evidence. So in today's class, today's curtain raiser, I'm going to talk for around 1 hour plus on these things. By no means I'm telling you to buy any of these stuffs. It's entirely your choice. I'll just give you a broader, big overview of antioxidants, and let's see how we build up our conversations as we move ahead. So patients' expectations, market forces, or kya kare, what more can we do for you, is driving us to write these medicines, and they are pretty expensive. An average course of say DHEA, or giving somebody a tablet like which contains some multivitamin like arginine or carnitines, they cost a lot of money. An average course of such drugs can be rupees 5,000 per month. That's a huge amount. On one side, we want to cut down the price, and then we are giving them medicines worth rupees 5,000 every month. And Is it justified? This is what I'm going to talk to you about. The big IVF add-on racket, the New York Times. Are we adding them on? Is it a racket or is it really working? IVF clinics are pushing women to buy needless extra treatment. So they say that people are buying treatment worth, as you can see here, $100 on average for undergoing an IVF cycle, which may not be required. So they don't add up. They don't add up for the result, but we are writing. So there are multiple things which come up, and keeping that in view, I picked up this particular topic for you. As you know me, I'm very fond of giving you some hard facts. But before I give you the hard facts, let's look at the doctor's perspective. Why do we write carnitines, arginines, NACs, or sometimes metformin? Why do we write them? First of all, we want to do something more. कुछ और करना है to benefit the patient. क्या करें? What do we do? To write a drug. It's got some research element. We keep thinking, okay, one day we'll get some data, we'll make a paper and understand why carnitine and arginine is working, or why 𝐂𝐐 is working, or melatonin is working. We want to do some research. Good, it's fine. Go ahead. Then there can be a reason we want to. Sometimes you come under the pressure of a lot of people when we start writing them. So just understand that we have to follow the concept of first do no harm. Whatever we do should have a reproducible outcome, auditable outcome, and there should be need to treat. Don't write a drug because we can write it. So that was our perspective. And coming to the patient's perspective, they need our help. They need our hand holding. Expenditure is a concern for them. Expectations are very high, but they still say, "Chalo, we'll sell our." I've heard people, they sell their house, they sell their villages, they sell their tractors for the treatment. So just see that patient life is not expendable. Whatever we do should have some meaning, and without a concrete evidence, we should not be writing any drug. That's the prologue of the whole lecture today. So let's see what more we can do to an egg, what we can do to its mitochondria, ATPs, what we can do, what we are doing. Is it correct? Can we do the same thing by using such lovely, we can use some vegetables, fruits. Can these things help us in curing the patient, or we need to go for antioxidants? Very, very attractive, like a buffet, very expensive, and 90% of the food is wasted. So we want to make our baby like this, or we want to have some reasonable outcome in the case. Keeping that in mind, we planned this antioxidants curtain as a razor for you. Let's deep dive into the whole physiology and talk about how these things work. So before, as we are starting, I would request that just try to control, alternate, and delete whatever you have in your mind. Just come to the class with an open mind. We'll build up the whole story again. You would be having your own ideas, your own perspectives. Just be with me for around 40-45 minutes, and let's see how we can build up the whole algorithm again and understand why are they required and why are they not required. So first of all, there are two things which we all have to know. One is pro-oxidant, second is antioxidants. So as we know that when we want to do something big, suppose you want to go for an exam or you want to go for a run, our heartbeat goes high, our heart beats faster. Exam hai, we want to go for a viva, we start sweating, we are worried. So that is not bad. Because somebody is not sweating before the viva, or somebody is not having anxiety before the exam. I think 99.9% of them, they have not prepared for the exam. Anyone who has read will have anxiety. This is pro-oxidation. Before any procedure we do, we get goosebumps. Even if I do a pickup today, I've done around 17,000. I still feel, okay, I am worried. I do the scans, look at the needle, things are ready or not. You just can't go and start doing a procedure without getting stressed out. But good stress. So now we have something called pro-oxidants, and they are the oxidants are the ones which are very important for the patient. In case there are no pro-oxidants, then the body won't work. Liver won't work, pancreas, kidneys, they won't work. Periods won't occur. So pro-oxidants are always good for us in small amounts. When the pro-oxidants become more, so when you go for the Viva and you blank out of stress, that is bad. That's something like when your stress becomes so much that you cannot speak. You start fumbling and the examiner says, 6 months ke baad mein aana. You have not read. Fine. So that's called, that can be, we can think about that's something akin to ROS or reactive oxygen species, or when the number of AOX will become more in the body. Look at this lovely picture. I was looking for some nice fresh image from Google. I got this for you. A normal cell will always work like this. And free radical, when they start working on this nice fruit, they'll start shrinking that cell. And more the number of this thing will occur, the cell will go bad. Just remember, gentlemen, ladies, that we have pro-oxidants. These have to be there in the body. Because there are no pro-oxidants, then the body can't work. The fruits can't actually bloom. They cannot become sweet. They have to be under stress all the time at some point of time. And then in case the numbers become more of oxidation, then we get something like this, and this is bad. So somehow we are always assuming that in case our patient has got endometriosis, PCOD, they've got poor ovarian reserve, they are like this. That's an assumption. So we start giving them oxidations, antioxidants. So we have to see that where are we standing, and how do we judge that our patient needs antioxidants or not. So this is what we'll be talking today. As I've told you, that all the molecules are basically in the body made up of carbon, hydrogen, and oxygen. Sometimes we add chloride, sometimes we add some other chemical, but the basic backbone of any hormone, any enzyme in the body is carbon, hydrogen, oxygen. Then we can have some, we call it CHO. Then we can have some metalloproteins which can get added here and there, magnesium, silicon. They're in small amounts which are present everywhere. And they basically help these molecules to get decayed or reform. So they're balanced by their bonds. And their bonds are. They can have double bonds or triple bonds. So when something happens and these bonds say break, then these molecules, they become unstable. And when they become unstable, they become reactive and they want to pair up again. When they want to pair up, they'll pair up with anything which is around, and they normally pair up with unpaired electrons. So when the bonds are disrupted, then they want to stabilize and they will hold on to whatever they're getting. Something like, I'm liking this ad in the TV which is coming about honey, Dabur honey. The issue that whenever you take honey, it will spill, and whenever it spill, it will go and bind any surface. So it becomes very messy. So now Dabur is selling one bottle, it's a plastic bottle in which they're selling their honey. So understand that whenever like honey spills, it becomes very messy. So when these bonds they break, they become very messy. They will go and attach and make everything very, very dirty and sticky. That's what is oxidation in the body, which as it is occurring. So when the bonds break, they will take electrons and they try to bond with other things which are around, and they will bind with proteins, lipids, carbohydrates. And then keep binding, and it's a cascade, like a nuclear reaction. It occurs it's like a nuclear reaction. So it will keep binding and keep creating instability. So just remember that some amount of pro-oxidation is always there, and some amount of ROS, reactive oxygen species are very important for us. They are important. Without this, our bodies cannot work. And they are the important part of our metabolic process, the metabolic pathways of the oocytes, embryos, and our defense mechanism. That's about the female and male reproduction. So now, moving one step ahead. So when the balance is perfect, when the bonds are breaking, they break and then they form. Break and then they form. They're not becoming unstable. This is important for tissue remodeling, hormone signaling. Because when cell has to divide, these bonds have to break, but immediately they form again in a very controlled way. And so when you look at it, it's a very important step for your cell division, oocyte signaling, ovarian hormone formation, endometrial changes, everywhere. When the woman menstruates, the cervical mucus plug is all controlled by generation of some amount of ROS, which are pro-oxidants and under control. So I can say the tummy of a woman, the men also in a small way, but for a woman, whole uterus, fallopian tubes, ovaries, endometrium, her whole body is continuously under attack of ROS. And something goes wrong, they go out of control and they start multiplying. So when they increase to high pathological levels, they can cause damage to the cell structures. And what are these cell structures? They can be epithelium lining of the uterus, epithelial lining of the fallopian tube. It may be the fimbria of the tube. It may be endometrium, cervical mucus plug, vaginal pH. It can be the follicles and the eggs which are not maturing at that point of time. It can be the endometriotic fluid which comes back due to the retrograde menstruation and it starts developing uncontrolled, and finally it will lead to the formation of endometriosis, PCODs, unexplained infertility. So there are multiple things which happen in the body and about which we will talk today. This is what I've written here. Until the normal, in the normal circumstances, the antioxidants are there in the body, a small amount. So ROS are formed, but then antioxidants go and shut them off. So there's a balance occurring in the body. So there is some amount of oxidation is occurring, and then a body itself is able to cure it. This is very, very important. And now, what are the antioxidants? Talking about the oxidants. What are the antioxidants? The unstable bonds are the oxidants. So there are some antioxidants in the body like vitamin C, vitamin E, selenium. These are, I won't take the names, there's so many of them, but they are the ones which are in the body, which will remove those pro-oxidants or oxidants, or they will draw a balance in the body. And these are non-enzymatic. They are small molecules. And then we have something like enzymes which are there in the body. They are like SOD, catalase, GSH, glutathione. A lot of them are there in the body. Reductase, they're in the body, and they are enzymatic oxidants. So we can have non-enzymatic and enzymatic. Normally, when we take pills or drugs, we are focusing upon these. So we also take something like melatonin. Nowadays, we can take 𝐂𝐭10. It has been found to be very effective. We can take arginine. So whatever we take, they are non-enzymatic antioxidants. And when we calculate the total antioxidant defense in the body, and we want to know the total antioxidant capacity, the term is called TAC, but it's still under research. So I won't talk about this much. So when you talk about the oral antioxidants in the body, they may serve to prevent and elevate oxidative stress. So in case we take vitamin C or vitamin E, we may take any tablet like arginine or 𝐂𝐭. They can elevate OS and they can help us avoid getting the problems like endometriosis, PCODs, preeclampsia, RPLs. So it is found that they can actually help us. Now, Do they help us, or it is the claim by the companies? We have to look at that now. So now look at this picture. In this picture, as I've told you, this picture you would have seen many times before. But please try to detach yourself from whatever you've learned till now. I don't say that you've learned anything wrong, but let's see how I put it across. So in the body, a lot of factors can cause problems. And these factors are obesity, undernutrition. We know about these things. I'll just skip it. I won't talk about them. Now, what they do, they tilt that balance. They make the levels of oxidant high and antioxidants low. As a result, the people come under oxidative stress. It means that when you go for an exam, we should be under stress. Otherwise, we cannot perform well. But in case we start fumbling and forget everything, it means that we're going to fail in the exam. This is what happens when the levels of ROS goes so high that the body is not able to control them. It is called high levels of ROS. And when we have high levels of ROS, they can lead to multiple problems. It can be cardiac arrest, it can be liver failure. Any disease in the body can occur due to these things, and IUGR, preterm labor, it can be spontaneous abortions, preeclampsia, diabetes, all can be due to a shift in this balance. But here, for organic purposes, for what we talk about IVF or IUI, we look at these things. So important for us is, in case you look at me, what is the most important for me this point of time will be age related. It can be endometriosis and PCOD. So I say, in case I'm able to cover these things up, I'm pretty happy. And rest all are the obstacle things which we have to handle them later. So today we're going to see, today we will learn how does these diseases can lead to high levels of ROS generation. And in case they are leading, how do we treat them? So what we do that we reduce these things to the maximal amount. Remembering here, in case you don't know that they are more or low and you start over treating, the antioxidants can also cause harm in the body. So they can cause harm medically as well as financially. They are pretty expensive drugs, and this we have to keep in our mind. Okay, so age related is my main worry, for which we normally give DHEA and other things. So moving ahead in the talk, infertility. Okay, so now we have to learn that we have to maintain a balance in the body. So ROS balance has to be maintained, and this is very important, the balance of ROS and antioxidants between the body. So ROS and AOX have to be maintained. They have to be balanced. We have antioxidants, pro-oxidants in the ovarian follicle. So if you look at the follicle, we'll always have, this is lying in the follicle, we'll find that we have antioxidants in the follicular fluid, which will help the egg to grow. In case we find that there is some imbalance, in that case, there can be follicular atresia, the eggs can be of poor quality, and that's the time we can have problems. Many times when we give people large doses of gonadotropins, when we overstimulate the ovaries, the levels of E2 go very high. In that case, also the ROS can be generated. So any stress which can lead to the ovaries overworking or the follicles maturing very quickly, so they go off balance. Normally they are supposed to make only one follicle, one egg every cycle. But if you start making, we want to make 18-20 eggs every cycle and we want to pump in hormones, then the balance will shift and there can be problems. So keeping that in mind, when we, due to these things or naturally, there can be free radicals in the microenvironment of the oocytes and follicular fluid. And we have to know that changes in these microenvironments can directly impair follicular development, ovulation, quality of oocytes, sperm-oocyte interaction, implantation, and early embryonic development, which will finally lead to, which may lead to recurrent pregnancy loss, recurrent implantation failure, and later on the lady can develop diabetes mellitus, she can develop hypertension, or she can have eclampsia or preeclampsia. So today we're going to talk primarily about how these things work in our body at the level of uterus, ovaries, and fallopian tubes, and the endometrium. So when we look at the conditions like PCOD, endometriosis, some genetic factors, cancer treatment, lifestyle, they can have caused this problem. And as I've told you, this is what will happen to an oocyte in case we have some imbalance in the body. In case woman is lacking the levels of androgens in the body and she's aging, she'll have large amount of ROS in the body, which will finally lead to a cell like this. So an egg like this will be a bad egg, I'm very much sure. So now as I'm moving ahead, we'll talk about how the where all we have the oxidative stress in the body. So we have it for reproduction, we have it in the follicle, where the follicles, the follicular fluid, in case we look at the follicular fluid, it is known that the follicular fluid has got a very high levels of melatonin. They have got very high levels of antioxidants. As a result, the follicle develops very quickly, and follicle will always safeguard the health of the egg. This is one you have to understand. The second point you have to know is that in case by any means the antioxidants in the follicle become low, then we'll have damage to the follicular wall, we'll have damage to the egg, and as a result, the theca cell compartment, theca cell won't be able to work optimally. So we have to, in case the theca doesn't act optimally, there would be lack of androgens. And that's the concept of giving the patient DHE. So the follicle can be very important. Endometrium, as we know, endometrium is a very dynamic part of the body. It is shedding every time it grows. It gets, it undergoes glycogen deposition, then it will shed. So endometrium is a mirror of the body actually. It's always seeing multiple peaks of hormones. You'll see a peak of E2 FSH, you'll see a peak of LH. So we've spoken about it multiple number of times. So this is what the E2 does in the body. E2 FSH LH, they will make an endometrium like a furnace. It will look like a furnace. So the endometrium is always under stress, and in case we have an imbalance, then we can have large amount of ROS being generated. And then there can be infertility. This is, we normally call it as unexplained infertility, where we don't know the cause. It can be in the cervix, it can be into the fallopian tube musculature, the ciliary function, but due to ROS being generated, all of the three things are being. So what we do is, when they're getting harmed, we assume they're getting harmed. We start pumping people with large number of drugs. So we have combinations of arginine, NEC, ashwagandha, hyponid. Name a drug which you can actually make. We are giving to the people, not even being sure whether they are working or not. Around 5 days back, I was taking an oration for around 200 doctors of Kenya. The Kenya OBG Society had called me for a talk on PCOD. The talk was for around 45 minutes. The talk got over. Their inquiry was very funny. They only wanted to know about hyponid. I was quite taken back that what is hyponid, a drug by Dabur, doing in Kenya. But what I understood that is one of the largest consumed drugs in Kenya. Has any one of you heard about hyponid?
Yes, sir. Yes, sir.
Do you use hyponid in our country? Are you people using it?
No, no.
Yes.
No, sir.
But I've seen prescriptions
No,
of some doctors, Ayurvedic doctors, they are using.
Yeah, it's from Dabur.
Yeah.
So Kenya doctors were only talking about hyponid. So it's quite surprising and quite funny. So now, as we move ahead to the topic for today, let's go into some science, and this is few pictures I want to show to you. These are how does an egg get damaged? Okay, whatever happens in the body, the problems can be occurring at the level of egg when the egg can get damaged. That is number one. When egg is of poor quality or egg is not multiplying, growing properly, problem is with the egg. Second big problem which we face is always the problem when sperm and egg cannot come together. Because sperm and an egg will come together in an in vivo atmosphere where we have the fallopian tube in which the sperm will go and hit the egg. In case the environment there is not good, in that case the fertilization won't occur. So we have to always look at the quality of the egg, the quality of the sperm egg interaction, quality of the endometrium. So this is where the implantation is going to occur. And once we look at these things, and it's quite nice, look at what all happens. We have physical and chemical aging. The ovaries are aging. So they age, and we have spoken to you large number of times about ovarian aging. So quickly, one quick bite. Can someone tell me the number of eggs in a woman at 40 years of age?
1,000.
400, sir. 1,000. 1,000, sir.
Normally at 40,
1,000.
at 40 I say 8,000, 40 I say 8,000, and by the time we see 1,000. Good, good. So you are with me. How many eggs are present in the ovary of a female fetus?
6 to 7 millions.
7 million.
1 million. 1 million.
Please check it once. I'm saying in utero. That's a homework. Please check in.
4 million.
20
over 2
millions.
million.
Yes.
10 million.
Yeah.
20 million.
Yeah. It's very high. You're right. So how many times does a woman menstruate in her lifetime?
400 times.
How many eggs she's losing approximately?
4,000.
Why 4,000?
400 times.
I always say 4,000 because I assume that 10 to 12 eggs may be recruited and one grows. So maximum I say is 4 to 5,000 eggs are used, and rest all eggs they age, and this is how they're aging. They age and die due to they undergo follicle atresia. So from 20 million to 1,000 and then probably 0 in 40 years, 45 years, they undergo atresia, apoptosis. And why do some women age early? Now, some women have premature ovarian failure. Some women just stop making AMH. The AMH can go down in some women. From where does the AMH come? Anyone, quickly.
Preantral follicle.
Primary and secondary follicles.
Very good. And from where does the NFN comes?
From tertiary antral follicle.
Tertiary. Late antral or early antral. Fantastic. आप लोग बहुत बात रखते हैं. I'm so happy. So when the ovaries are aging, the follicles are not forming. Or when there is ROS, follicles won't form. The follicles won't form properly. They won't grow properly. They'll undergo atresia. The AMH will fall down. Just remember. So due to the multiple ovulations, due to the aging, chemical stimulations, the ovary can undergo oxidative stress. It's called ROS can increase. This is important. And they can affect the ovaries. And when the ROS increases, ovaries will start aging. It's a very vicious circle which comes into play. The follicles undergo atresia, number of follicles will fall down, and ovarian reserve will fall down. And then, now, when you talk about this, Angrezi, I'm telling you some English. But what actually is happening at the level of the cell? Can someone tell me what drives a cell to grow? What makes a cell to grow, a cell to proliferate, a cell to breathe? Quickly.
Mitochondria.
Mitochondria. How does mitochondria work?
ATP generation, sir.
And what is required for mitochondrial functioning ATP formation? What does it require?
Oxidative phosphorylation.
They require CoQs. Great. So ये सब चीजें हैं 1 2 3 1 2 3 4 ये देखने cells start aging, I understand. They go bad, I understand. But what is making them age? What is making them not proliferate? There is a stimulus from outside. The woman may be smoking. The woman may be having a drink. I'm talking with the woman today. She may be having under a lot of stress. She may be diabetic. She may be hypertensive. All these things can affect the ovarian function, and she can go into premature ovarian failure. Maybe genetic problem, maybe radiotherapy or chemotherapy. But what is actually happening in her body is that in the cell, in the follicular cell, mitochondrial activity will reduce. Mitochondria will stop working. ATP synthesis won't occur. CoQ10 is deficient, and antioxidant enzyme activity will fall down because the follicle by itself is making antioxidants. And when these things occur, there's a chromosomal damage, and as a result, we've got infertility, abortion, or we can have abnormal babies being conceived. I got large number of slides. I may not cover them today. In case I spill over, I think I'll request Akriti to make it part 2 or part 3. This is an important topic. I just can't move ahead. Is this concept clear to all of you? Okay, what happens at the level of mitochondria and ATPs and CoQs? Is this much clear to you?
Yes, sir.
Yes, sir.
Great, great,
Yes.
great.
Yes, sir.
Now, I'm in no hurry to move ahead. I'm in no hurry to move ahead. You have to, the class, I can't cover this up, and I'm happy to see all of you here. So now what happens? When you look at a follicle has got 3 parts. It has got an oocyte, primordial follicle, or a primary follicle. Around it will have granulosa cells, and around that will have theca cells. So we have an oocyte, and we have ovarian follicle, which has got granulosa cell and it has got theca cell. They have got very important function. As I told you many times, the main job of cells of granulosa is what? Can someone tell me? What do they do? Quick answer. What do they make?
Formation of
FSH production, sir.
What do they make?
Estrogen production.
Estrogen.
How?
Under
Aromatase, sir.
Under the influence of cortisol.
Aromatase.
Aromatase, sir.
Aromatase. Exactly.
आगे बढ़ना पहले था क्लास से पहले था वो तो बाकी लोग बोलेंगे हम तो aromatase बोलेंगे ओके शाबाश very good so keep talking antioxidants in the body I've told you some are enzymatic some are non-enzymatic so I'll ask you what are these
Non-enzymatic.
they are enzymatic they are enzymes and these are the antioxidants in the body. These are the ROS. So now they have to balance each other. In case they don't balance each other, then it collapses, and then we have poor quality oocytes and poor embryo development. Or when theca cells are not there, these cells are not getting properly androgenized. In that case, we'll have problem with the luteinization. LH won't come, and then we'll have defective luteal phase. As a result, we'll have infertility. So the whole thing here works. How we get an LH search. See, ovaries don't want to work. In case I tell you to, okay, I'll give you one quick question to all of you. In case I tell you to run for 10 meters, what will happen to you? 10 meters.
Comfortably.
Comfortably run. Shabash, comfortably. And that's good for us, good for us. Now I tell you to run on a treadmill for half an hour, what will happen?
Will collapse.
Many people conquer. Good. So when a follicle is gradually maturing, When the follicle is maturing at its own pace very gradually, we say it is normal growth. There we don't get ROS. We had some LH surge, things work and things become fine. But now what we do is we are pumping an ovary with hormones. We are giving a large amount of LH and we are hyperstimulating to get more number of eggs. And when more number of eggs are formed, stress is increased. And when it is increases, there's an imbalance and the quality of eggs can go bad. So if the ovary is compromised, we are in a problem. Then we have poor luteal phase defect. Keeping that in mind of this hypothesis or assumption, we are trying to give people antioxidants when we are carrying out their IVF cycle. This is one corollary I'm giving it to you. I won't say right or wrong, but this is what we are doing. So summary, अगर हम summary देखें, तो हमारी body में क्या हो रहा है? What's happening in our body? Look at what's happening in the body. What is happening at the level of follicle, happening at the level of oocyte, and what is happening in the body at the level of luteinization. It will lead to luteal phase defect. So whole of the follicle is getting stuck. This is the oxidative stress. But here I will say that it is not the end. This is not an end here. The end point will be the direct effect upon the endometrium also, which is not properly studied. Even the endometrium is getting affected. The fallopian tube is getting affected. So I want you to take a break of 30 seconds and read this particular slide. So look at the effect of stress on the follicles, oocyte, and corpus luteum. All these three things are getting affected, and that's very, very important. And they will all lead to poor quality of oocytes and poor type of embryo development. And then poor implantation later. So the woman goes into RPL, or she can have recurrent implantation failures. This thing we have to keep in our mind as we are moving ahead. And they will all lead to infertility. It can be primary, it can be secondary. So the use of antioxidants in treatment of gynecological conditions, PCOD, endometriosis, unexplained infertility, and poor ovarian reserve. These four things are the ones which are very challenging for us, and we keep talking about them. So let's look at one by one what happens in a PCO patient. Whenever we have ROS, PCOs are always under high levels of LH and high levels of E2. They all cause oxidative stress to the follicle. So we'll have, due to this oxidative stress, we will have apoptosis of the granular cells and we'll have poor oocyte development. This is what is happening in the person who has got PCOS. It's happening why? Because of LH being very high, E2 being very high. There's an imbalance in how the cells are developing, and the two-cell theory is compromised here. As a result, we'll have poor theca cell development, we'll have poor development of an oocyte, and the lady may go into the apoptosis of the eggs. So what happens, in case you look at the whole concept from a very far away level, you'll find that we have all these things occurring in the PCO. And these we all know. This we are all aware of also. And when they all occur, it will lead to generation of stress, ROS. And when ROS comes, these all things will occur. Follicles won't grow, they won't develop. And we keep blaming insulin. We are actually blaming insulin here. But here, maybe the direct action of ROS upon the follicles. So all these things, IR, hyperinsulinemia, hyperandrogenemia can lead to these problems. How do we treat them? The aim will be with that we have to reduce the oxidative stress, angiogenesis, and inflammation. All these three things we have to now reduce. And when you want to reduce them, these are the things. So we actually should look at antioxidants. But we want to add something, we start adding these things. And I'm sure we are fully aware that we give people some drugs which contains antioxidants like these, and they are known to help the woman ovulate better, and they can act as the scavengers for antioxidants. So I'd like to ask you, now I have with me around 160 people at this point of time. I'd like to ask all of my friends here with hands on their heart, how many people out of you are using an antioxidant for PCO patient?
Yes, sir,
Only
we are
vitamin
using.
D, sir.
Vitamin
Vitamin
Using
D.
yes, sir.
Okay. Vitamin D you're using? Okay, no problem. Can you put in a camera and let's have a small discussion? In case you feel like, I mean, it's good to talk, and I also use. I don't say I don't use, though it is not recommended. I also use many times. So just want to say, in case like a head count, how many of you will be doing? Is anybody who's not using antioxidants in case of a PCO patient? Somebody not using, all of you, or
Sir,
all are using? Yes.
Using all.
only vitamin D, sir.
Only
Only vitamin D.
D.
Only vitamin D.
Perfect.
Minoxidil, chiroanisotol also.
Yeah, perfect.
Ah, chiroanisotol and minoxidil, and only vitamin D.
So, Akriti, any comments on minoxidil and inositol from your side?
Sir, they are basically works on insulin sensitivity with very little antioxidant effect.
Yes. This is what? Great. I got so many hand ups. That's a good idea. I think we can raise our hands on every point.
Yes, sir.
Good. Thanks, Akriti. So what you have to understand is that the MI and DCI are not actually antioxidants.
Exactly, they are not antioxidants.
Exactly. Here comes the answer. So, but PCO we use multiple drugs, and the very good drugs are berry seeds and a lot of things people give. So, thing is that some use vitamin D, some use Civetol, some use 𝐂𝐿. 𝐂𝐿 many people are using. A lot of people are using NAC nowadays. Some people use arginine. So whatever, people start using things. So, but these are the ones which are in the market, which we all can use. Fantastic. Maza aa gaya. Now I'll make it a bit more complex. And in case you ask me things, I may not know all these things myself. It's a complex thing, but we have to know that all of these metabolic pathways can have a problem. There can be inflammation occurring here. There can be oxidation occurring at cellular level. There can be oxidation in the muscle, oxidation in the body organs. So, kahin par bhi, whenever we are having such complex enzymatic derangements occurring, antioxidants may work, and this is our assumption. And then here we like to give to treat PCOS. We start doing the reduction. We start giving one of these drugs. And average amount of money which a couple spends on drugs, like a single drug or a plus type of category of drug, is around rupees 5,000 per month. So by any means, I don't have any authority. I'm not myself sure whether they work or not, but we are also using. But I think we should always look at the patient in a more comprehensive way. And when I enter talk, I'll take you to Cochrane and talk about what Cochrane says. Coming to endometriosis, the second.
So how long the treatment should be used? Antioxidants.
Antioxidants, it depends upon what type of problem you are having, but normally we don't give it for more than 3 to 6 months. We have more idea about the male. About female, we don't know. And for that, I'm going to sum up with Cochrane reviews that in the male infertility, all these antioxidants are good. We know that they work. So we give it for around 3 to 6 months. But about the female part, I'm not aware. Nobody knows about it. The only antioxidant, metformin can be an antioxidant to some extent. So metformin, we give it 1 month prior, before you start the case, do the pickup, and after they conceive, stop metformin after the heartbeat. So metformin as an insulin sensitizer, the metformin as an antioxidant, I can say for around 45 days to 1 month or 2 months. Other drugs, you keep giving for 3 to 4 months. Same case, look at
vitamin D, sir?
vitamin D तो सबको देना ही है. Vitamin D तो सबको दे दो आप. Vitamin D is
How
a
long, sir?
How
chronic
long,
acid.
sir?
Normally, see, we have patient is with us for around 3 to 4 months maximum. We are giving, and we feel that in case we give them vitamin D or we give them something like Uprise or some vitamin D3 sachets for 8 weeks, it will correct their deficiencies.
Daily dose, sir?
Yeah, no, weekly dose. One sachet, 60,000 units weekly, the dose, 8 weeks, the dose recommended. After that, we don't follow. And trust me, after those 8-10 weeks, patient don't come back to us also. They go. They will come to you now. You will also start. So some of these poor guys are under tremendous stress the way we are handling them. But none of these drugs should be given for more than 3 months. So then they can cause toxicity. The deficiency is corrected, they will cause toxicity.
Including metformin.
Metformin, we are only giving. See, metformin has to be an indicated drug for as an anti-diabetic drug. In IVF and in IUI, metformin has got no role. Metformin we are primarily giving to reduce the chance of ovarian hyperstimulation.
Sir, it action over endometrium also. The endometrial mitogenesis also it prevents.
I don't deny, but these are all hypothetical things. This is what I'm going to tell you. They're all hypothetical things. In IVF or IUI, there is no role of giving metformin until we are giving it for a problem in the woman. Giving it empirically, we don't give. Empirically, we give basically to reduce the chance of ovarian hyperstimulation. We give it for around 8 to 10 weeks, and that's all we do. Then we stop. Giving it lifelong is not indicated by no means. And about the role of endometrium is all in gray zone. There is nothing, no book says that we should be giving it. Read the PCOS guidelines. I've been telling you guys again and again. I hope we've given that PCO 2018. Please have a look at that. Endometriosis, again, endometriosis is a plethora. Like we make the morning breakfast on a Sunday, we make a lot of good things at home. This is endometriosis, full of chemical reactions. So everywhere there is hemosiderin, heme, macrophages, RBCs, iron coming together. And then as you can see, there is hemolysis occurring, early proliferation, recruitment of the macrophages, hemosiderin deposition, ferritin, everything comes. Neoangiogenesis starts occurring. And finally, this is the formula which is occurring in the body. It's like a furnace again. Endometriosis is like a furnace in the body. A lot of fire is occurring everywhere. And we don't know how to handle this fire. And when we don't know how to handle the fire, we throw water over it. हम उसे पानी डाल देते हैं. And how do we do it? We start giving them some antioxidants. So look at, I just want you to spend 30 seconds more with me. Unbalanced pro-oxidant status. I've told you already what is pro-oxidation. Pro-oxidation is good. It is like having some stress, and when you go for your exam or before one night before the exam, you want to study till midnight, that is pro-oxidation. Good. But in case we become so fumbling and we cannot write our exam only, then it is a failure. That occurs when the pro-oxidation goes into imbalance. So here, when it goes into imbalance, this is what we get. Endometrial receptivity will go bad, interaction won't occur, embryo toxic environment will occur. This all occurs in a patient who has got endometriosis. A lot of things are occurring in her body, and it can occur even in a woman who have got PCOS. But in endometriosis, all these things are. I'm sure you will understand that these things we already know, and they are like all brother and sisters in arms. They come, implant over the cavity, and then all these things will occur. And finally, we'll have poor quality oocyte. Reduced number of oocytes may be there, and there is increased pre-enteral follicular atresia. This would be occurring. Multiple pathways are being activated, and as a result, we find that your total antioxidant capacity is gone down. And as a result, we have poor outcome in the women who have got endometriosis. Same thing, the same diagram I wanted to show you again and again because I want to focus on the basic pathogenesis. Drugs आपको सब pharma वाले पढ़ा देंगे. I'm sure you would be getting 2 to 3 pharma teams coming to you every day and teaching you their drugs. Give this, give selenium, give magnesium. This I don't want to teach you. I want to teach you how it actually works. Though we'll go to those drugs also later. So we have, in a case of endometriosis, we have retrograde menstruation and all the things will occur in the body. And then we have activated macrophage. The peritoneal macrophages will get activated. Endometrial lesions will occur. Inhibitors, the transcription factors will come. Cytokines will come. So all these things will occur here and it'll go into imbalance. So as they go into the imbalance, there will be new angiogenesis occurring, then degeneration of extracellular matrix, and all these things will lead to poor outcome in the woman who has got endometriosis. This one thing will happen, all happen. No. Now coming to the unexplained infertility, here a lot of things are occurring. The whole body is pretty complex. A lot of things are happening in the body here. It can be due to the smoking, drinking, alcohol, the DNA damage due to multiple reasons. It can be endometriosis, PCOS, hydrosalpinx, UV light, blah, blah, blah. A lot of things occur. And in the female, it will lead to these many things. I'm going to talk to you about female infertility today, not the male infertility. So this we have spoken many times before also. So I'll talk about this. So just have a look at this and see what all can happen in the body of a female. Delayed conception, reduced fertilization, poor mitochondrial function. So इससे पहले हमें पता था there is atresia occurring. We knew that the follicles can be of poor quality, but today I want you to go to the level of 𝐂𝐭 and melatonin and try to understand why these things are occurring. Well, the endpoint is poor oocyte viability, poor numbers, and poor implantation. This is what I wanted to leave it on you. Coming to poor ovarian reserve.